Welcome back. Chuck Asbell with Middle Georgia Ambulance joining us this morning. We're talking about a very important topic, the correct way to take care of someone if someone near you has a seizure.
Yeah, that's what I was saying, during the holidays, we're getting family together, a bunch of people are going to be there, people are running around the house, and seizures are an extremely scary situation if you don't know anything about them or if a family member's never had one before. So treating them the right way is extremely important, and making sure you know what to do, if that situation does occur. Yeah,
and there's some easy steps we're going to go over now, and some of these things, like you said, can make a huge difference as long as you know the right thing to do.
Exactly. We do have a video, showing the proper way to do things. The first thing that you want to do is, of course, call 911, get us on the way. And then you see, there's not necessarily going to be chairs right there on top of them, but anything that is close to the patient, you want to move it out of the way. Their body may be convulsing at that point in time, and while their body is convulsing, they're going to be shaken, and and there could be something that they could strike their hands on, their head, any part of their body. So you want to clear the path all the way around to make sure that there's nothing there that they could hurt themselves on.
And as you mentioned before, when something like this happens, people are going to be scared. So you want to be able to know these tips and be able to react the proper way.
Exactly. And then you saw she knelt down and she held her head. At that point in time, you want to support the head, control the head, and on the next clip you'll see that she's going to take control of the head, make sure that it's safe. But if you have your jacket, if you have a pillow, if you have a blanket, something you can just slide right up underneath the head. That's just to protect the head, make sure that they don't hit the head on the floor or anything else. Just really maintaining, that control. You don't want to hold them down. That's not the right thing to do. Never try to hold somebody down. But you do want to support the head and make sure that they don't hurt themselves at any point in time. And that's pretty much what you're going to do during the seizure. While the seizure is actually taking place, you're pretty much there to take care of the head, make sure that they don't hurt themselves, make sure that the area is clear. And then after the seizure, the body is extremely exhausted, So they have what we call a post-ictal state, or a time basically when they go to sleep. That is perfectly normal. It's okay. At this point in time, the main thing you want to do is protect the airway. You hear people say, oh, they had a seizure, they're going to swallow their tongue. It's physically impossible to swallow the tongue, It's not going to happen. But what they refer to is the fact that the tongue relaxes, and they sound like they're snoring, and they sound like they may choke on it. So the best way to do this is in the next clip you'll see. The best way to control this is you're just going to roll the patient up on their side. All right. What that does is that lays them over to the side. If they do get sick, if they do get nauseous, and they actually get sick at their stomach, what happens there is if you lay them up on their side, they won't choke on anything. It opens that airway to the side.
All right. Very important advice. We certainly appreciate that this morning. Thanks.